It's great to have you here today. We're going to share a bit about the work we're doing at the NMC with the review of the potential regulation of advanced practice. You'll be with us for the next hour. We are going to record and share on our website, and we'll also be asking you to complete some postcard questions at the end. It's really important that we get feedback and hear your views so that can contribute to the review and the work that we're doing. There'll be a few people still joining as we go along, but we will make a start. Next slide, please, Simon, if that's okay. So before we do some introductions of our team, just a little bit of housekeeping. Can we just ask, and I think Simon is keeping control of this, that everyone will be automatically muted. We are monitoring the chat box, so if you've got any questions or feedback or comments, please do post them there. We'll do our best to answer any questions as we go along, but there's a lot of people joining today, so we will aim to come back to you with any unanswered questions. We'll do an FAQ type document, which we will share on our website as well. I mentioned that we're recording. We'll share a link with some of the key questions, the postcard questions. We'll upload the recording onto our website, as I said, and you can switch on live captions for accessibility if you need to. And if you're unable to access the chat, you can email us your comments and queries to our dedicated advanced practice at NMC UK inbox, and we'll get back to you on that as well. So we'll just do some introductions if that's okay. My name's Paula McLaren. I'll know many of you. I'm the Senior Nursing Advisor for Advanced Practice here at the NMC. I'm a nurse by background. I'm still clinically active, most recently working as an advanced nurse practitioner in general practice. I will hand over to you, Anne.
Good afternoon, everyone. As you can hear from all the beeping, we've still got people joining us. As I said, there's over 600 expected. I'm Anne Trotter. I'm Assistant Director for Education Standards here at the NMC. Great to have you with us.
Right, I'll go next. Hello, everyone. My name is Aditi Chaudhary Gandhi, and I'm Head of Standards at Nursing and Midwifery Council. I'm leading the team of standards development specialists who are working with the team of nursing and midwifery advisors for developing and furthering this work. So welcome everyone, and thank you for your time.
Thanks. So just to let you know what we'll be covering over the next 45 minutes or so, we're going to tell you a little bit about the community of interest, share a bit of the background and context for this programme of work and our review of advanced practice, talk a little bit about our regulatory remit, which most of you will know, but we do find we get a few questions on that. So we've got a couple of slides just to cover that as well. A little bit about kind of what is advanced practice and current thinking, and then talk to you primarily about our programme of work and the progress that we've made up until now. So our working principles, our approach, our key lines of inquiry, and of course our timelines. And then how you can get involved, and interspersed with the agenda are some questions for you. So we've got a couple of kind of polls and word clouds and things for you to be able to get involved as well. Next slide, please. So our community of interest, we've had a great response to people signing up to our community of interest. So there's huge amount of interest in this piece of work that we're doing, which is why you're all here joining us today. We've got over 1,000 of people who've asked to be kept up to date and informed of the work that we're doing. And we'll also be inviting people along from the community of interest to get involved in some of the sessions that we're running as well. And we'll talk about those in a little bit more detail. In terms of who's joined our community of interest, so predominantly, as you would expect, mostly people working for the NHS, but also kind of public voluntary sector and other organisations as well. In terms of kind of Obviously, we're a 4-country regulator, so across the UK, the bulk of individuals joining are from England, less so from the other countries, Scotland, Wales, and Northern Ireland. But this roughly reflects individuals on our register as well. And just some of the professional roles that people have that they've shared with us in the community of interest. And interestingly, over 600 of people on the community of interest describe themselves as an advanced practitioner. Next slide, please. And this is over to you.
Thank you very much, Paula. Just waiting for the slide to move on. So the team asked me to do the really exciting stuff in talking about our legislation. So I'll try and make it as exciting as I possibly can. But as you all will know, everything we do is bound by legislation, and that for us, that's the Nursing and Midwifery Order. And one of the reasons that we're flagging this is that there is a programme of regulatory reform going on that is being led by the Department of Health and Social Care on behalf of the 4 UK governments. But this order sets out what we as the NMC, as a professional regulator, are able to do in relation to our fundamental role to protect the public. So as many of you will know, we set standards for education and training. So that's the programmes that we set standards for in relation to becoming a nurse, midwife or nursing associate, and certain post-registration standards. We set standards for performance and conduct, commonly known as the code, and that's what shapes us as professionals in whatever area of professional practice we do. And for that tiny number where there are concerns about an individual's competence or conduct, we will investigate those concerns. Obviously, we want to make sure that professionals on our register, whether they are new to the profession, early careers, or mid or late career people, are looking at their own professional practice. And we do that through a process of revalidation. And just for those of you that are really interested in numbers, we have almost 800,000 professionals on our register, 788,638, and our mid-year data report is coming out at the end of this month, so we fully expect that will increase. And looking at that data report gives us an idea of people, joiners and the types of joiners, and we know that the diversity of our register has increased in recent times. And then, of course, we will quality assure education and training programmes that we set standards for. But what we don't do, and many people think that we and the Royal Colleges are exactly the same, so we don't regulate the healthcare setting where care takes place. We don't regulate healthcare support workers, although recently some asked if we could. And we don't campaign, but we do support and influence those of you on the register, and we'll do our best to support in any way we can. Next slide, please, Simon. So the 3 things, and you've heard me mention this already, we regulate, that's the things we must do. No one else can do this on our behalf. We will support in the ways that we can, and sometimes that's through resources and guidance, where we know that there are particular challenges. An example of that was during the pandemic, where we published a statement on how we will continue to regulate during the pandemic, and a more recent one, how we will continue to regulate during industrial action. And then, of course, I mentioned data. A lot of our data can be useful in terms of influence. It gives an idea of starters and leavers and the breakdown of our register, and that supports workforce development, which every country is absolutely keen on doing. So they are 3 main areas that we will focus our work. And in relation to Paula, Aditi and I, a lot of that comes through our standard setting and supporting implementation of our standards. Thank you, Simon. Next slide. So where are we in relation to advanced practice? In the NMC strategy for 2020 to 2025, that committed us to doing a comprehensive review of advanced nursing practice and to consider whether additional regulation is needed, because it's really important to remind us all that nurses and midwives in advanced practice roles are already regulated, but it's whether more was needed given the role and the responsibilities of people in advanced practice. And then for some of you, I noticed there are colleagues from QNI and from the Institute for Health visiting here. We did lots of work on our new post-registration standards that we published last year. And we very clearly said that that work would be the work, a bridge to the work we do in relation to advanced practice. And then in the year that's just recently gone, we said that we would commission research, but we said at that time that we would extend that discovery phase to include midwifery. And it was important because there may be things that we as a regulator think are important for both professions, but it's equally helpful to know whether there's things that we need to do differently to recognise the unique nature of those two professions. And then earlier this year, we went to Council in May with a proposal when we published the Nuffield Trust report, and we recruited an independent chair and began a steering group. And that independent chair is Kay Fawcett, OBE. We're absolutely delighted to have her, and Kay's really integral to the work because the steering group will be making recommendations to our executive board. And this line of work, and Paula and Aditi will be talking more about the work we're doing now, is all to do with the proposals that we will take to our council in March of 2024. Next slide, please. So here we are in terms of what we do. As I said, all nurses and midwives and nursing associates in England apply here as well, but nursing associates is not in the scope of the advanced practice work. So to do that, everyone has to be in our register. They have to maintain the registration using revalidation. But in relation to the work that we commissioned, the Nuffield Trust identified that although some fantastic work has been going on with advanced practice globally, as well as the UK, and the fact that the 4 countries have a framework, there are variations that can be seen. And sometimes that variation relates to the profession, sometimes that variation relates to the setting where people in advanced practice roles work. And so there is variation between the country, even with a country-specific or an employer-specific governance. So here's a question for you, and we'd like you to answer it. And colleagues will be showing you how to do that. Can you please think of what you think were some of the key risks that were highlighted in this report? Simon, over to you. So just type in a word or a risk that you think that was identified in the Nuffield Trust report. And you can do that now. Thank you for those that are doing it. Please have them coming in. And as you know, with the word cloud, the more the things that come in gives you the size of the word being greater. So we've got over 300 with you today, and we've got 59 responses so far. So what I'm seeing is ambiguity around scope of practice, variation in scope, education variation. So the word variation is coming up in so many different ways and contexts. Training is different, different standards apply, governance challenges, lack of standardization, patient safety. Now that's quite small in terms of who and how many of you are saying that, but clearly that's something that's of vital importance. We've got something around titles and roles, so keep them coming in. But what even this early indication shows to you is that there is no one way of people working in advanced practice. There are different routes to becoming an advanced practitioner, either through education and training that's either formalised or informal, as well as what they're called, as well as the lack of governance and lack of understanding about what advanced practitioners do. So thank you very much for that. That's just a small straw poll, really, really helpful. Next slide, please, Simon. So in terms of those key risks that were submitted within the report, the first one is clearly risk to the public. And clearly, as a professional regulator, we play an important part on the protection of the public, not solely. We do that alongside system regulators. We do that alongside the self-regulation that we as professionals all have. And we do that alongside the responsibility of provider and employer organisations. But what the Nuffield Trust and their review did, they found that although a lot of the literature did not relate to regulation of advanced practice, what was identified, the latent risks associated with some of the activities that professionals in advanced practice roles do. And some of that focus was particularly around the ability to safely and accurately diagnose and provide the treatment interventions that were needed for individuals. They also identified a lack of clarity in relation to people in advanced practice role, scope of practice. So some do things that others don't. Some do many more things that others don't. And some do things that people don't even identify as being at an advanced practice level. Certainly, their findings in relation to the public, so very limited understanding of the role by members of the public and people who use the services of advanced practitioners, was noted. And that's certainly something that's been highlighted to us in the public engagement. So when people do know, they seem to be very familiar with what they're capable of and what value they bring to their care of themselves or their loved one. But others have got no idea. And sometimes that no idea is they don't know who's looking after them, not just that they don't know that this person is an advanced practitioner. One that you all picked up on was the variation in preparation for education and training and what that actually looks like. And then the variation in relation to employers and what employers expect people in advanced practice roles to do and how that's governed in relation to those different employer organisations. And then what they actually do on a day-to-day basis can vary. And that's not just in terms of in busy and challenging times, but when some people have a job description, those job descriptions will vary dramatically too. And then certain settings and sectors were highlighted by the Nuffield Trust as being those areas where higher risk potentially was seen. And all of that leads to that impact on those individuals receiving care, on employers, as well as the professionals themselves, because professionals want to do a good job, but sometimes not having that clarity on what it is they can and cannot do, or what it is they should and should not do, is brought into stark focus. So they're just a quick summary of the findings of the Nuffield Trust report, and I'm going to pass back to Paula and Aditi. So back to you.
Thanks, Anne. So now, before we even consider the whole question of regulation of advanced practice, we need to be able to pin down what exactly we mean by advanced practice. So next slide, please, Simon. Now, there have been various attempts at actually defining what advanced practice means. Lots of different countries, not just within UK, but internationally as well, have varied ways in which they look at advanced practice across nursing, midwifery, and the wider healthcare professions. By and large, there is general agreement that there are 4 pillars to advanced practice, clinical practice being one aspect of it, leadership and management being one aspect, and some would argue strategy also could fall into that sort of category. Then there's the education pillar, and then there is research. Now we know that this all intertwines with an individual scope of practice, which again can be quite different. And as part of the scope of practice, some advanced practitioners, one might argue, also have prescribing qualifications. But then again, we know that there are some distinct professions where being able to prescribe is not at all a mandatory requirement for anyone calling themselves an advanced practitioner. So going back to the whole point about there's a huge variation in what we mean by advanced practice. How is it defined? How is it understood? And that varies across the profession. So even within the professionals that we regulate, nurses and midwives, there's a huge variation in the understanding, the concept, and the recognition of what actually counts as advanced practice. We do know there is some kind of recognition of the fact that when we are talking about advanced practice, it is about a level of practice, a higher level of practice is what we do talk about. And that does include definitely a high level of knowledge, but also experience, being able to manage complexity, being able to coordinate care, often lead teams that can be multidisciplinary in nature, be involved in the planning of not just care, but also planning of services. So being at the forefront of some of the decision making is what could define what an advanced practitioner does. But then there might be elements to it. So when we talk about the 4 pillars, there could be differences in the way in which 4 of these pillars are manifest in terms of individuals' scope of practice. So going back to the whole point about, is there something that could define at a uniform level what advanced practice is? And is it our role as a regulator to be able to actually define all of that? We have been looking at some of the definitions that currently exist, some of the approaches and the frameworks that exist, not just in UK, but internationally, to be able to identify what are those nuggets or what is common across all of those different definitions, and can we use that to define or to come up with something that could look like working principles or working definitions of what actually we mean by advanced practice. So moving on to the next slide, please. So in terms of our review, and Anne has touched upon this, so we started off this review on the back of our post-read standards review, where we did hear quite a lot of our stakeholders saying that specialist practice is also a form of advanced practice. So we knew that when we did a review of our post-read standards, those would be a bridge for any sort of work that we do for advanced practice. So building on that work, we started off with a discovery phase where we commissioned some research to understand what is the lay of the land, what does the landscape look like in terms of advanced practice. So as part of that, we looked at the views and the opinions of advanced practitioners who are currently those individuals who are working as advanced practitioners, but also looking at some of our strategic stakeholders and what sort of frameworks exist in the UK and beyond. So that was a piece of work that we commissioned, and that was all part of the discovery phase. Building on that, we are now in phase 1. And this is a critical phase because really what we have done is identified 9 different key lines of inquiry. These are all interconnected, so they are a way of us to divide some of the evidence that exists, because there's a huge amount of evidence that exists, not just at UK level, but internationally, in terms of advanced practice and the link to public assurance, public protection. So on that basis, what we are going to do is develop options to take to our council meeting in March of 2024 in terms of what we should be doing or can be doing as a regulator. So these 9 key lines of inquiry are going to help us look at the different aspects, and Paula is going to go into a little more detail further on in terms of what those key lines of inquiry are. But the aim is to look at all aspects of advanced practice, right from what are the current frameworks that exist, what is the evidence in terms of the beginnings of advanced practice. So we know, for example, that task shifting was one way in which advanced practice came for nursing and midwifery to some extent. But now we know that that has now gone into a different phase of enhancement of practice. And we hope that any work that we do will not stifle the innovation that is expected or that is likely to happen now and in the future. So it's really looking at different aspects of the key lines of inquiry. And I know some of you in the chat box and in the word cloud also talked about the variation in educational requirements, in the training, the support, the supervision. So that is also another key area that we are going to be looking at. So moving on to the next slide, please. And what we want to do really is to ensure that any work that we do is all about public protection. So essentially, we as a regulator, our main goal is public protection. So with that in mind, we want to make sure that the options that we develop are going to be enhancing public protection, provide public assurance that the people who use the advanced practitioner title are indeed competent at the level that would be expected. So with that in mind, we are firmly looking at bringing in the public voice, which is very much at the heart of this review. With that in mind, we have set up a public advisory group, and that includes individuals, so members of the public who potentially have long-term conditions or who are caring for individuals with long-term conditions, who we would class as experts by experience. We also have representation from charity and advocacy groups. In addition to that, at an NMC level, we have a public voice forum, which is a group of established individuals who come together, members of the public, and a group that we can go and test some of our thinking, and they are a sounding board for us for testing any of our regulatory options and decisions. So we regularly meet them. We've had 2 really good interactions with them. And this week as well, we hope to meet in person with this wonderful group and test some of our thinking and our general direction of travel. In addition to that, what we are doing is 4-country engagement. Being a 4-country regulator, we are minded that any options that we develop, any thinking that we do, or any evidence that we draw upon has to be derived from not any one country. It has to give equal weightage to all 4 countries of the UK. And that also feeds into some of our stakeholder engagement. So we have got nursing and midwifery advisors who we are working with quite closely. And we have set up some 4-country engagement. We will come to some of that. And a lot of this information also exists on our website. So we've got roundtables that we have set up. And we would encourage you and members of your team, your colleagues, to come along to these engagement events, because we want to hear from a diversity of stakeholders. That is ultimately the aim. It's very much a co-production piece where we work with our stakeholders to develop our thinking and the options that we will take to council. So moving on to the next slide, please. In terms of our working principles, so at NMC, we have a well-developed standards development methodology, and that also applies to any policy work that we do. So as part of that, we have devised some working principles, and these have been tested to some extent with a smaller group of stakeholders, with our steering group, and with our public advisory group. So what we have identified are these key principles which should guide our thinking and any options that we develop. First and foremost, we want to make sure that anything that we devise or develop must promote public protection, and it must enhance public assurance or public confidence. We also want it to be based on our ambition as a regulator. So we said in our strategy in 2020-25 that we would look at the options. So we haven't decided on any one particular option. We are still very much in listening mode, in discovery mode, building on the evidence that we have. And we want to make sure that anything that we develop is very much suitable for both nurses and midwives on our register, and it applies to all 4 countries of the UK. Anything that we develop has to be based on the principles of co-production. It must be ambitious and future-proofed as well, and it absolutely must align with the principles of right touch regulation. Now, right touch regulation is a principle that has been set forth by the Professional Standards Authority, and it is about the optimum regulatory intervention that is needed to achieve public protection. So that is the aim of it all. In addition, we want to make sure that any work that we do reflects evidence. It is built on the principles of co-production and reflects the NMC values of being fair, kind, and ambitious. And we promote a person-centered approach in everything that we do. So these are our guiding principles for this piece of work. Going on to the next slide now, Simon. Thank you. So at this point in time, we have identified some high-level options. So these are the 6 potential regulatory options that we have identified. Bear in mind that you could have a combination of some of these options, and many of them are not necessarily many of them are not independent of each other. So there might be some options that actually rely on any of the others. So there is a potential interlinkage across all of these options. Now, starting on one end would be maintaining status quo. So keeping things as they are, not really intervening in any sort of regulatory way, through to the other end of the scale where we talk about full-scale regulation. Now, what full-scale regulation would mean is us setting standards for advanced practice and quality assuring programs for universities who actually deliver these programs. So that is what we mean by full-scale regulation. So those are the two extreme options that exist, option 1 and 6. But within those, there is a whole array of options that are available. That could include something like any of our existing regulatory tools and mechanisms, such as revalidation, where we could have some enhanced targeted approaches around revalidation for advanced practitioners and use that as a mechanism for seeking assurance. We could equally have a principles-based approach, much like we have for our preceptorship, where we look at 4-country principles that we could put forth as a regulator that exist in advanced practice. We could also have a more collaborative approach where we look at any kind of joint approaches with 4-country chief nursing officers or with other regulators or with other professional bodies. So that is another potential option. Bear in mind that there are pros and cons, costs and benefits attached to all of these options. There is also a middle option of introducing a test of competence, which brings me back to the point that this is not necessarily mutually exclusive to the point of full-scale regulation, because actually, in order to devise a test of competence, we would need to recognize some set of competencies or proficiencies or set some kind of expectations of what we mean by advanced practice before we even introduce a test of competence. So there is that to consider. Then there is the credentialing option. Within that, it could be the NMC actually credentialing or us recognizing the credentialing that is provided by other bodies. So that could be any of the 4-country professional bodies, or it could be any other Royal College, for instance, that provides credentialing in this area. Bear in mind that all of these options, again, have cost benefits, potential unintended consequences as well. So I'm just going to pause there for a moment and see if anyone's got any key points that they're raising in the chat box in this area. But do use the chat box to tell us if there are any options that you think we should be thinking of and they haven't been put on the screen already. If you can think of these options as we go along as well, that is completely fine. I can see that you are using the chat box, which is great. We do want to keep those coming because we're going to take away all of the chat box comments and analyze those. And we'll see what we can really do. We might think of publishing some kind of FAQs document as a result of what we're picking up as well. But please do put in your comments in terms of any options that you think we have missed out and we should be considering. So over to Paula, I think for the next bit of questions. And we have a poll for you. So over to you, Paula.
Yeah, so thanks, Aditi. So just a question, a poll question for you. You should see a poll come up shortly. And the question is, which regulatory option would give you assurance on the competency of a professional working as an advanced practitioner? Is it credentialing, principles-based approach, revalidation-linked approach, test of competence, setting education standards, approving programs and quality assuring programs, or is it none of the above? And as Aditi said, it might be that we have regular conversations where 1 week we kind of think we're in the setting standards is the way to go, and then we have further conversations and kind of review the evidence and the literature and change our minds. So we are very much in listening mode, as Aditi said, and thinking about which of these options would work best with our right touch regulation approaches. So I'm not sure. Can everyone see the poll there? I'm not seeing.
Yeah, we can see it. We can see it. If everyone would just like to, this is just a first past the past things based on things you've heard so far and what you know yourselves.
Someone's saying they can't see the poll. Nobody's answering, Simon. So some of the questions and queries that you're putting in the chat box, we're going to come to. It's really nice and reassuring for us to see that the questions you're asking, we're addressing through some of our key lines of inquiry.
Yeah, we've had 246 responses, Paula, so far, with setting standards coming out on top so far.
Okay, brilliant. Thank you. So I'm going to move on to some of our key lines of inquiry. As I said, hopefully talking through some of these will help address some of the comments that you've been making in the chat box. And as Aditi has said, you know, this is a way for us to be able to manage the evidence. It's a way for us to be able to address some of those risks that have been highlighted through the Nuffield Trust report, but also through the evidence, and also to help us shape our recommendations. Simon, next slide, please. Thank you. So we've got 9 key lines of inquiry, or CLOEs, as they're known to their friends. And each of these CLOEs has a defined scope and outputs and has a small working group, which includes our nursing midwifery advisors and our standards specialist. And these key lines of inquiry allow us to scrutinise the evidence, develop direction, but also identify gaps and test some of the assumptions that we've got. And as I said earlier, some of you on the community of interest will be contacting you to come and join some of the groups that we're having where we can really have some of our assumptions tested. So our first key line of inquiry is, as you would expect, is looking at advanced practice frameworks across the UK and thinking about the potential for the NMC for us to develop a UK-wide advanced practice approach. There are a number of different frameworks in use with similar principles, but it's about us being able to look at those frameworks and think about what might potentially work for us in the regulatory space. And we're also looking at and comparing advanced practice models internationally as well, and thinking about what we can learn from those that exist in other countries like Australia, New Zealand, etc. Number 3 is looking at scope and level of practice. And I know that when we did our word cloud, that was something that came up, that there was variation in scope and level of practice. And again, there's a lot of work that's already been done in various frameworks across the UK. And it is about looking at those frameworks and really understanding what is currently in existence and thinking about what scope and level and what our role is in the regulatory space around advanced practice with relation to those. CLOE number 4 is looking at task shifting, and it's a term that causes a lot of us to kind of, you know, it's like nails scratching down the board, but it is where arguably advanced practices come from in that nurses and midwives have been asked to take on roles and tasks from other healthcare professionals, in particular medical professionals. So we are looking at the evolution of advanced practice, if you like, and balancing that task shifting with patient-centered care principles, because as we said earlier, the public and patients are at the centre of the work that we're doing. We're also looking at supervision and assessment, and that's not just supervision and assessment of programs and of individuals undertaking advanced practice programs, but thinking about supervision post-qualification and what that might need to look like in terms of supporting advanced practitioners in their roles into the future, and also coming into that continued professional development as well. Many of you have commented on the other regulators, and a key piece of work for us and one of our key lines of inquiry is looking at what other regulators do in this space around advanced practice and taking up the opportunities to potentially do something together. And we've had 3 meetings already with great attendance from the other regulators, and there's been a firm commitment to develop some shared principles around advanced practice, which has been really great. So we are progressing that work as we speak. We've also talked about the costs involved in potential regulation of advanced practice, not only for us as an organisation, but also potentially for registrants, for employers, and there's a whole lot of things involved that we need to take into consideration. So we are undertaking an economic evaluation to look at that and the implications of that to support our findings as well. Our Chloe's is specifically looking at the at reviewing the risks and benefits associated with advanced practice overall, but also specific options that Aditi has presented in the last slide, and thinking about what that might look like and what those risks and benefits mean for us as a regulator. And our final Chloe, and again, this is something that's been mentioned in the chat box, is considering the implication of regulation of advanced practice for internationally trained nurses and midwives. And that's a piece of work that is going to form part of this as well. So those are our key lines of inquiry. Chloe 9 was a late addition, if you like, but something that came up as really important through the work that we're doing. And we're hoping, as I said, that that our key lines of inquiry will help us develop our evidence and provide the opportunity for us to have relevant conversations through various engagement events to be able to help us to get to the position of making some recommendations for our council in March of next year. You can skip those couple of slides, Simon, thanks. So just in terms of the work we're doing and how we're managing the work, we mentioned lots of engagement. So over November and December, we're already in November, we'll be doing a number of roundtables, which you may well have been invited to. So we want engagement, we want to hear feedback from nursing midwifery researchers. We want to make sure we're up to date with the research that's going on at the moment, not just that which is available in the literature, so that we can take that into consideration. We want to speak to employers and hear from employers, educators and learners. We want to hear from and speak to consider the implications for those. Aditi mentioned 4-country engagement. So our nursing and midwifery advisors will be engaging with specialists, and that's clinical specialists, specialist nurses, advanced practitioners across the 4 countries to get feedback, as well as members of the public. We'll also be adding to this, we'll be meeting with systems regulators as well, and there may well be further roundtables or engagement events that we put on. So do keep an eye on our website. We also have 3 key groups: our joint regulatory group, our public advisory group, and we have a specialty subgroup as well. And all of this work is overseen by our independent steering group, which, as Anne said, is chaired by Kay Fawcett, OBE. And it's our steering group that will help pull together and help us to shape our recommendations, which, as I said, will go to council in March of next year. Next slide, please, Simon. So this is another question for you. Are there any specific groups or networks that we should be engaging with that we haven't talked about today that you think would help us to shape this work? So just share in the chat box any thoughts around that. Are we engaging with the right people? Are there other people that we should be engaging with that we haven't talked about? So AP, yes, we are engaging with AP. Specialist nurses, yeah, absolutely. Specialist nurses we want to hear from as well. So we're interested in kind of, you know, implication and consequences for those in specialist roles. of the regulation of advanced practice and you know, the differences between specialist nurses, specialist midwives, consultant nurses, consultant midwives, and advanced practitioners as well. This is really helpful. You know, on seeing these come up, and it's going quite quickly, and we will go back over these. Most of what you're saying are involved in our engagement in various shapes or form. Our steering group has stakeholders in strategic organisations and positions across the UK. We're engaging with the other regulators, as I said, academics, yeah, educators. Yeah. So that's really helpful. So thank you. Keep them coming, because as I said, we will look back at these. I just saw a comment flash up about midwifery practice. And yes, absolutely. We have 4 country midwifery advisors from a variety of backgrounds, from consultant midwives to those working as academics and educators, to help us shape this work and challenge it and challenge us and our assumptions as well. So that is a key part of this work, and we're very clear that any options that we come up to, and any options that we come up with, any recommendations have to be relevant for both nursing and midwifery professionals on our register. In terms of our timelines, Anne talked about council in May 2023. We've updated council in Wales at the end of September with the progress of our work. As I said, we're undertaking further key lines of inquiry work and engagement work throughout November and December. We have a number of challenge sessions, which I mentioned. Some of you will be invited along to be able to challenge our assumptions and help us to shape this work. I mentioned oversight from our project board and our independent steering group. We will then be pulling all of this work together, including our public engagement, all of that engagement that we're doing, and assimilating that and drafting our options early next year, with a view to taking an options paper to our council in March 2024, with the hope of starting phase 2 of this work, which will of course involve looking at the preferred option from council and undertaking further detailed comprehensive consultation from April 2024. And alongside this, Simon's on the call. Simon's our comms and engagement lead, so we will be putting comms out on our website and updating on the progress of the work as we go through. Next slide, please, Simon. So we mentioned at the beginning of the session that we want to hear from you. We've got a postcard survey which you will receive after the webinar is finished, and there's a number of questions that we'd like to ask you and receive feedback on. So we'd like to understand how additional regulation of advanced practice nursing and midwifery would benefit the public and people who receive care. We want to understand what you think are the risks to the public, to professionals in advanced practice roles, to employers and to others, that additional regulation of advanced practice might mitigate. We want to hear from you about the factors that we should account for when considering the need for additional regulation of advanced practice. And we also want to think about health equity and equality, and addressing health inequalities, and in what ways additional regulation of advanced practice could benefit the public and people who use health and care services. As we said, we really do want to hear from you. This is your feedback is going to help us shape the work, shape our key lines of inquiry. So it's really important that you do take some time to be able to provide responses to the postcard survey for us, please. Next slide, please. So you're already well involved. You're here today, which is really great. It's great to have so many people here, and thank you for being so engaged and wanting to share your opinions and feedback with us. We mentioned the roundtables, the specialties roundtables, particularly that some of you might want to be involved in. Engagement with our nursing midwifery advisors across the 4 countries, and you'll receive various communications about those events as they're happening over the next couple of months. And also hopefully sharing our work within your networks as well. If you'd like to get more involved, you can email us at our email address, which is advancedpractice@nmc.uk/UK. And you can read more updates on our website, which is the Advanced Practice Review. If you search NMC Advanced Practice, it will come up for you. And then we've got one final question to ask of you, is to just share anything in the chat box which we didn't cover today, but that you'd expected to hear about. Or anything else that you'd like us to know. As I said, there's a lot of people in the meeting, and there's lots of comments, there's lots of feedback. We will be reviewing the feedback and putting something on the website in the form of an FAQ type document, which we've used before and has been well received. We've got about 5 minutes. So I don't know if we've got time, Aditi, for a couple of questions.
Yes, we do. I mean, just to provide assurance to everyone that the slides will be shared, so they will be on our website. And if there are some questions that we can pick up or we can respond to straight away, we will potentially put them on the website in the form of an FAQ. But I can see that a lot of the questions are more questions for us to reflect in our key lines of inquiry and to refine this piece of work, which is equally valuable, I would say, because that does help us shape our thinking and the way forward. The other thing that I did want to kind of provide assurance on is a lot of you have recommended that we work with HCPC and GMC. So we do have a key line of inquiry that is specifically looking at the potential for interregulatory collaborative approaches. And as Paula mentioned, as part of our engagement, we have got an interregulatory group. We've had a couple of meetings with them, and we are looking to develop some sense of commonality, some set of common principles of what it means to be an advanced practitioner, regardless of what professional background you bring in, because we know that a lot of the advanced practitioners will be leading teams that are often multidisciplinary in nature. So we are speaking to our colleagues in GMC, HCPC, all of the 9 regulators, but equally Social Work England has also been coming along to some of these meetings. And we are hoping that through some of our roundtables, we will speak to employers and potentially some of the systems regulators as well. Because as some of you have said in the chat box, governance around these roles is just as important. So we do want to look at regulatory options, but we don't want to stifle innovation. We don't want to be introducing any undue burden on any parts of our register. So we are thinking about what is the best sort of right touch approach that we can adopt. So do send in your comments. You can join the community of interest by dropping a line on the advanced practice email that we shared. You can also sign up to our newsletters. So we have targeted newsletters that you can sign up to through our website. We have newsletters for educators and students, for employers, for members of the public, for professionals, and those will give you the most up-to-date information on everything to do with what we are doing as an organization, not just advanced practice, but the key messages around advanced practice are delivered through those newsletters as well. But do keep an eye on our advanced practice webpage, because that is where we will be putting out the dates for some of the upcoming engagement. Do come along to those. Equally, send us your feedback through email. We are very keen to hear from you. So I just wondered, Paula, if you want to say anything, and equally after that, if Anne, you want to share any messages.
Yeah, thanks, Aditi. Yeah, just to say thank you so much for your contributions. As Aditi said, you know, we will go through it all, we will read it all, we will provide some FAQs, as I mentioned before. It's really great to have so many people here. I hope that the session was helpful. There's a lot of work. It's a complex piece of work, but we've got a really great team working on this. We're really keen that we engage with relevant stakeholders, including yourselves. So it's really great to see that you are so willing to contribute and provide feedback. So thank you.
Yeah, just final thanks from me. Fantastic that so many of you come and stayed the distance. This is a complex piece of work. We're not saying it isn't. We know how many times it's been attempted in the past, and if it was easy, it would have been done by now. And New Zealand took 11 years to bring in regulation of advanced practice. We're not going to take 11 years. We're going to work far more swiftly, but it is complex. So having all of you support us and challenge us in equal measure is fantastic. So thank you very much for joining us today, and we will stay in touch with you. Many thanks, everyone.